So this exercise is going to be our 90-90 breathing exercise that we want to do. And the main thing that we're trying to accomplish here is that we're trying to get good intra-abdominal pressure in this area so that it can be a helpful protector of the spine and maintain stability in that spine as we're doing dynamic movements. And during those dynamic movements, you're not totally relying on the muscles in the spine or the joints necessarily in the spine. You have a full belt essentially that's going to help you maintain stabilization through there, okay? So in this position, we're gonna start out laying down like this. I always like my patients to take a few breaths here, so just inhale, feel that expansion, maintain that expansion while you're breathing, okay? And then use your fingers like a T-Rex, honestly, middle finger, forefinger, and thumb, and then use those finger pads right above your iliac crest to feel and make sure you're expanding into all areas. And if you feel an area that isn't expanding quite as much, you can press into that area a little bit, you can rub on it, just some sort of tactile cue to let your brain know that that area needs a little more love, okay? So we breathe in, hold there, hold that there. And then if you feel really good about that, then you can move up into a 90-90 position. So hips at 90 degrees. And then ideally we also have our feet at 90 degrees too. So everything's 90 degrees here. Make sure that your back is not arching up like this, nice and flat against the ground as best we can. If you struggle to get your back to stay against the ground, you can always put your feet up to start on a chair or a large med ball or anything like that, just to let your legs relax onto something. But if you feel good, you can stay like this. And what we're gonna do is same situation. Breath in, create that pressure, feel around. Do we have good pressure there throughout? And if we do, we're gonna hold there for 30 seconds. Breathing in, making sure that we're maintaining that pressure. If we're not, giving it that tactile cue of rubbing or tapping or anything like that. Hold that for 30 seconds. And then come on down. So that is our simple 90-90 breathing exercise that we can do to help create stability in this area and take pressure off the back. And so some things again to remember there is make sure that you're expanding into all regions. So in the front, the sides, and the back. If you're having trouble with it by itself, you can always, like we said, put your legs up on a chair or up on a larger medicine ball or anything like that to help take that pressure off. And then you can progress up to where it's more comfortable without having that there. And then if you're having trouble expanding in an area, just use those tactile cues, press in on it. Don't feel afraid to press in a little deep. Anything to communicate to your brain that this area needs more pressure, needs more air coming into it. And what we'll do is that'll help to take the pressure off the spine and give you less pain and better ability to perform in your daily life.